It's being called a public health crisis. We have new information to share with you this morning from the National Council of State Boards of Nursing, and it does show about 500,000 nurses are planning to leave the profession within the next 4 years.
All new for you this morning. Jamie Warren is live looking into the impact here in Arizona. Good morning, Jamie.
Good morning, Justin and Kaylee. It is a startling number, and the president of the Arizona Nurses Association tells me that burnout from the COVID-19 pandemic is partly to blame here, but there are other factors as well.
I'm even more excited to now go and be their primary RN.
Over the years, ASU has seen an increase in nursing school graduates, and that's important as Arizona ranks 7th in the country when it comes to states with the highest nursing shortage. How are they feeling?
From what I hear, and this is a universal feeling that I get from all of the nurses that I speak to, regardless of the setting, is that staffing continues to be a crisis. They're tired. They're doing their best to keep up.
Heidi Sanborn, president of the Arizona Nurses Association, tells me there are a number of reasons, including pay, stress, and work-life balance.
I think there's this myth that you only work 3 days a week, so it's somehow a lighter schedule. But the reality is it's incredibly physically and psychologically demanding.
Even a rise in violence at the bedside.
This ranges from patients to the public and family members who are being aggressive and assertive towards nurses, where to the point nurses do not feel safe leaving their shift and walking to their car.
The issue is nationwide.
We need nurses more now than ever. Our population is growing. We have folks that are retiring, registered nurses that are retiring.
Results from a recent survey show 46% of nurses plan to change careers because the negative effects of the job. In return, Sanborn says that you as the patient could feel the impact.
An inability, if you're going to be admitted, to get a bed in a hospital room because there's not a nurse there to staff it. Delays in care are a significant concern.
Was legislation that just passed last year. It is allowing grant funding for tuition to be paid for more than 900 nursing students in our state. That's at local universities, including here at ASU, with the promise that they need to work in our state for the next 4 years after they graduate. For now, reporting live in Phoenix this morning, Jamie Warren, ABC 15 Arizona.